All right, guys. It's the FBI warning. All right, guys. FBI warning. All right. Federal law allows citizens to reproduce, distribute, or exhibit portions of copyrighted motion pictures, videotapes, or video discs under certain circumstances without authorization of the copyright holder. This is called fair use and is allowed for purposes of criticism, news reporting, teaching, and parody, which doesn't infringe of copyright under 17 USC 107. The views, thoughts, and opinions expressed in the text belong solely to the author and not necessarily to the author's employer, organization, committee, or other group of individuals. All right, guys. So, not a long lecture tonight. HIV. Okay, we'll just take things slow. That way, you guys can really understand the material. There's no need to rush. All right. So, tonight we're going to talk about HIV by HIV. All right, let's begin. All right, so HIV. And for you guys that are studying for the Nclex, for those that are studying for the board, you need to kind of know why you're studying any type of infectious disease. All right. And according to the NSCBN, always use the NSCBN as your point of reference. Why do I need to study HIV? You know, this is the reason. This is why you are studying all of these infectious diseases. So go ahead and take a look at this. And it's NCSBN, guys. Sorry about that. NCSBN. So these are the people that write the NCLEX, the NCSBN. They write the NCLEX. So why do I need to study HIV? Evaluate clients' response to treatment for infectious diseases. Make sure you remember that. Assess client care areas for sources of infection. Apply principles of infection control. Follow correct policy and procedures when reporting a client with a communicable disease, and educate client and staff regarding infection control measures, and utilize appropriate precautions for immunocompromised patients. Educate clients about prevention and treatment of high-risk health behaviors. So I want you to remember that high-risk health behaviors. So this is why we're studying HIV. This is the importance of HIV. All right. So I want you to make sure that you remember that. This is why we're studying. At the end of the day, when you study any type of infections, this is why. All right. All right. So HIV. When you're studying HIV, remember it's a system disorder. Remember it has medications. Remember it has diagnostic procedures. And remember it has nursing skills. So you have to understand the entire concept of HIV. So system disorders, medication, diagnostic procedures, nursing skills. All right. So when you're studying this infectious disease, make sure that you look at it as a whole, because remember that the board wants to know that you know everything about HIV. All right. So we're going to talk about the pathophysiology. Not too much, just a few keywords that I want you to remember about pathophysiology. All right. We're not going to get too involved in it, but there's a lot of information about HIV. So I want you to kind of really hit these points. All right. So pathophysiology, HIV. All right. HIV is an infection that leads to profound pathology. So either directly through the destruction of the CD4 and T cells, they destroy other immune cells. The infection destroys neuroglial cells. And what happens? The patient becomes immunocompromised. And if you guys just think about HIV, if you've ever saw or you've ever worked with a patient with HIV, you know our focus is to keep them safe from any type of infections. Okay? We are trying to keep them safe because they are immunocompromised. All right? So remember that CD4 plus T cells, all right, guys, this is going to be very low because the infection is definitely destroying the CD4 and T cells. So remember CD4 T cells, guys. The disease is definitely, the infection is definitely destroying the CD4 cells, immune cells, neuroglial cells. All right. And so what happens is the patient becomes extremely immunocompromised. So just write down for this image here, right, CD4 T cells. CD4 plus T cells, because that's the issue. Okay. The HIV infection is leading to the destruction of this cell, CD4 and T cells. Okay. So I want you to remember that CD4 and T cells. All right. So what happens? What's the issue? What's the pathophysiology as it progresses? What's the pathophysiology of HIV? Progressive invasion of HIV. All right. So guess what? The immune system starts to decline and opportunistic infections begin to emerge. Remember, the immune system starts to decline and opportunistic infections begin to emerge. That's the issue with HIV, guys. The opportunistic infections. It breaks the immune system down. Okay, the patient can't pretty much fight off anything. All right. Now, there's different stages of HIV. Different stages. Okay. It doesn't happen instantly. Okay. The acute stage. First 2 weeks after being infected, this patient starts to develop flu-like symptoms. First 2 weeks after being infected, large amounts of the virus begin to reproduce in the body. And I want you to remember, guys, first 2 to 4 weeks after being infected, guess what? This person can transmit the infections completely unaware that they have it. They can transmit it. First 2 weeks after being infected, large amounts of the virus are being produced in the body. All right. This patient is at risk for transmitting the infection to other people. They're not even aware. Okay. They just have these flu-like symptoms. We all get sick every now and again. So we don't really know what's going on, but this patient has contracted HIV. So the patient has like flu-like symptoms. Viruses are being produced in the body, high amounts, large amounts of viruses are being produced in the body. And the patient is high risk of transmitting this to someone else because they're unaware. They just think I have the flu. I don't feel good. Okay. So stage 2, you see that word? Latency. Latency. They also call this asymptomatic HIV. So asymptomatic, no symptoms, no idea what's going on. virus is living or slowly developing, and it can last an average of 10 years without treatment. 10 years. Okay? One thing I want you guys to remember is medication decreases it, but does not eliminate the risk of transmission. So you will have to educate your patient. The medication does decrease, but does not eliminate. So make sure that you are educating. Remember, we talked about health promotion and maintenance. Adolescents, young adults, we need to make sure that they understand that the medication does decrease, but it does not eliminate the risk of transmission. That's a big deal for health promotion and maintenance, the medication, because there's a myth, or some people tend to believe that if I'm taking the medication, I'm non-detectable and I can't transmit the disease. Just be careful. It does not eliminate. All right. So the latency stage, guys, this is asymptomatic. So I want you to write asymptomatic for this. Asymptomatic. All right. Stage 3, AIDS. Okay. It's AIDS, Miss Amy. Stage 3. It is the most severe, the most damage. Okay. The most severe. Okay. Damage to the immune system, which increases the risk of opportunistic infection. And I don't want you to forget that. Okay. It increases the risk for opportunistic infection. Remember, this virus, this infection is destroying the immune system. All right. Immunodeficiency virus. Remember that. And most importantly, the board wants you to know the CD4 count less than 200 cells per millimeters cube. Remember that, less than 200. Okay. And this patient now has an opportunistic infection. They're going to say, you no longer have HIV, you have AIDS. You have progressed to stage 3, you have AIDS. So that CD4 count less than 200 and an opportunistic infection, they're going to say you have progressed to AIDS. Okay. Survival without treatment is 3 years. And this patient is definitely at high risk for transmission. All right. So that's one thing that we have to make sure that we educate. But remember that CD4 count less than 200 and an opportunistic infection. Okay. That's how you know that patient has gone to stage 3. That patient now has AIDS. All right. So risk factors. Risk factors. What puts a patient at risk for contracting HIV? What puts a patient at risk for contracting AIDS? What puts a patient at risk? So now we're going to focus on the system disorder cause. Okay, the cause. What happened? What are the risk factors? What type of life or what type of behaviors does this patient have? What causes this? Like, how did this patient contract this? How do I know, so I can educate this age group, so I can educate this population so they don't contract this virus, this infection? Well, these are the patients, guys, that we must educate. These are our high risk patients. So IV drug needles. Are they sharing IV drug needles? Are they sharing syringes? Most people get very upset when they hear about turning in needles for fresh needles. But guys, if the patient is already suffering from a drug addiction, we're trying to make sure that the patient does not contract HIV also. Okay? So you have some communities, they will give the patient clean needles. Okay? Because they know that this patient is at risk. When they share IV drug needles or syringes, they know this patient is at risk. Okay? For contracting HIV. Unprotected sexual intercourse, someone who is not in a serious relationship, someone who is promiscuous, or maybe someone who is sometimes there are people that solicit and they sell. They're in that area where they're selling themselves or having unprotected sex for money. So these are the individuals that we have to educate as patients, as nurses. All right, we have to make them aware that they are at risk for contracting HIV. Sometimes you'll see the nurses in these areas like walking around, letting them know and passing out condoms to try to protect this particular population. All right, now especially receptive anal intercourse. All right, if you have multiple sex partner, and if you have a history of sexually transmitted diseases, guys, they're saying that you are at risk for contracting HIV. So we have to make sure that we are educating this particular population. Okay? We have to let them know, listen, if you come in contact with infected blood, or if you come in contact with secretions, or if you come in contact with body fluids that are infected with HIV, then the likelihood of you catching HIV has increased. You're at risk. All right. Nurses, okay, needle stick injuries, that puts you at risk. Lack of circumcisions put you at risk. Maternal HIV, and men who have sex with men, transgender women who have sex with men, and Black or Hispanic males. This is what we have to promote with this community and this age group. We have to let them know you're at risk for contracting HIV. All right. So sharing IV drug needles, guys, or syringes puts the patient at risk for contracting HIV. All right. So what causes this patient who's HIV to progress to AIDS? Not receiving any treatment. Non-compliance. So I want you guys to make sure you write that down. That's a huge health promotion and maintenance. Non-compliance. Because those antivirals, guys, it makes HIV patients very, very sick. It makes our clients very sick. So compliance is a huge issue. And without the treatment, it can progress to AIDS. All right. And older age also. Hey, Megan. All right. Older age also. Okay. So just remember that. Risk factors: HIV progressing to AIDS, having more than one infection. Let's say, for instance, if you have HIV and then you have that opportunistic infection, TB, that causes a progression to AIDS. Let's say you have HIV and you have poor health, poor nutrition. That helps progresses to AIDS. Stress, guys, progresses to AIDS. And some people are just genetically predisposed to go from HIV to AIDS. All right. This explains how some clients succumb to the infection before others do. All right. Because sometimes it's genetics. All right. So for our clients, guys, for health promotion and maintenance, we have to tell our clients, listen, nutrition is the key. Nutrition is the key, and medication compliance is the key. All right. We need these patients to be as healthy as possible. We need our clients to be as healthy as possible so HIV will not progress to AIDS. All right. So let's talk about the incidence. How often does it happen and who does it happen to? Because it's very important. So we're going to hit the cause again. We're going to focus on the incident, the cause. Why is this happening? Who is it happening to? Where is it happening? How often is this happening? All right. So let's look at cause. Guys, in the US, okay, all right, worldwide, guys, not, you know, we always think of the US. We always say, oh, the US, the US, the US. Look at how many people, 36.7 million people worldwide are living with HIV. 36.7. Okay. The average time between exposure to the virus and diagnosis of AIDS is 8 to 10 years. All right. So the average time between exposure to the virus and the diagnosis of AIDS is 8 to 10 years, guys. All right. Now, adults, all right, adults and males. In the US, approximately 81% of adults and adolescents with HIV are male. Okay, so just remember that approximately 81% of adults and adolescents with HIV are males. So now you're getting an idea of who I need to promote, who I need to educate. All right. And the predominant means of transmission is male to male sexual contact. Blacks and Hispanics. So health promotion and maintenance is definitely for this population. We have to make sure that we're educating this particular population because they are at risk. It occurs more in these populations. All right. And the NCLEX wants you to know that. They want you to educate this population. Okay. And we talked about health promotion. I keep talking about it. I keep talking about health promotion because I want you guys to remember that. If I have a patient who's Black, Hispanic, okay, and they prefer men to men, I need to make sure if they're between the ages of 20 and 39, I need to let them know what happens. I need to let them know what plagues this particular age group. I need to let them know what plagues this population. And guys, I've gotten into so much trouble just being honest. I have gotten into trouble. I have had people to walk out of this lecture because a lot of people don't want to hear it. Okay, but as a nurse, if you're going to work in this community, if you're going to work with the population, guys, you have to know what's plaguing the population and you have to be honest about it because you never know. You may actually help someone. All right. So 20 and 39 and be ready because when you start speaking of sexual preferences and when you start saying Blacks and Hispanics, guys, it can cause people get very upset. Okay. But as a nurse, as long as you know that you are educating and that you are coming from a good place, please let them know. Okay. Trust me, I've gotten into plenty of spat. Someone even reported me once because I said Blacks. Okay. So just remember for the board and as a nurse, you have to understand what is plaguing this particular community. Yes. Very upset with me. Very upset with me. Okay, because it's discrimination and sometimes they say like systemic racism. So you have to be very careful. But as a nurse, it's like, okay, do I walk out of the door and do I just not say anything? Or do I just maybe I can help someone because I would want someone to help me. Okay. Yeah. Now, age groups, adults between the age of 20 and 39 are at higher risk for the AIDS virus. So guys, on your health promotion and maintenance sheet, make sure that you write down that when you are educating this particular age group, you know that you have to educate them about HIV and AIDS. Okay. It's just something that we have to do. Now we're on topic 4. Miss Michelle, whenever there's anything about race, and sometimes even when I'm in class, I'll just gloss over it because I know that it affects everyone in a different way. But as a nurse, it's like, well, maybe if I say it, I can probably get through to somebody. Okay. So it's just definitely something to think about. All right. So topic 4, complications. All right. So let's talk about the complications of HIV and AIDS. So remember your concept maps. Remember your concept maps, and complications is something that you definitely have to know for the board. It's something that you need to know for your exit. The complications. All right. Complications of HIV. Remember, guys, HIV, it destroys the immune system. Destroys it. So we have to try to protect our patient from opportunistic infections. We have to protect our patients from these opportunistic infections, guys. All right. HIV wasting syndrome. Remember, nutrition, 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 nutrition. All right. The complications are neoplasms. The complications are pre-malignant diseases. All right. So that cancer, it starts to form. Remember, the patient doesn't have, our clients don't have immune system. Okay. Immunodeficiency, they don't have an immune system. And of course, HIV can progress to AIDS and then death. So these are the complications. These are the complications of HIV progressing to AIDS. So we have to educate our patients, and we have to know the complications. So this is just a visual representation of the neoplasms. So look at kind of where they may form. All right. This happens. This is the complication of AIDS, HIV AIDS. All right. So the next thing that we'll discuss now is expected findings. So if you're taking care of a patient, of our client has a diagnosis of HIV and AIDS, what can we expect? All right. What are some signs and symptoms that you and I can expect to see? All right. This is very important, guys. So this is that symptoms box for our expected findings box for your ATI concept map. Symptoms. And the reason why, guys, you have to know what to expect, because you have to know the difference when to call a physician and not to call the physician. Okay? Expected findings. You're not going to spend most of your time on the phone calling the doctor or the nurse practitioner about something that's expected from HIV and from AIDS. Okay? So expected findings is a big deal, especially when we talk of prioritizing our care. All right? So remember that expected findings. Okay, so expected findings: mononucleosis, like or flu-like syndrome. Flu-like syndrome. Okay? That's something that we can expect after a high risk exposure and inoculation. All right? The patient may have flu-like syndromes, mononucleosis like or flu-like syndromes. And guess what, guys? After a high risk exposure and inoculation, the patient may be asymptomatic for years. And you guys know that a patient may be asymptomatic for years. They'll remember in the first stage, the patient will be very sick, have the flu, okay, get better, and may be asymptomatic for years. Do you think this is why it spreads the way that it does? Because you're asymptomatic. You don't feel bad. You don't feel sick. Okay? At first, it's that flu-like symptoms, and then it goes away. All right? Expected findings. Okay? Fever. Okay? Sore throat. Acute HIV infection. The patient is going to have a fever. The patient is going to have a sore throat. The patient is going to have muscle pain. Okay? Muscle pain. Headaches with pain, guys. Headaches with pain. Remember the virus? A lot of the patients with coronavirus are complaining of headaches. Okay? So this patient is going to have headaches with pain occurring behind the eye, guys. So fever, muscle pain, joint pain, headaches with pain. These are some expected findings. Okay? These are some expected findings. And then don't forget the flu-like syndromes. All right, this is expected. Flu-like syndrome. Okay? Yes, it's true. Ms. Megan, it's true. All right? Yes, that's how it can spread. Non-detectable viral load. Exactly. So now the flu-like syndromes are occurring. Okay? Expected findings. Okay, in stage 2, you can expect some nausea. You can expect that nagging cough. All right? The nagging dry cough. And also, guys, chronic diarrhea. This can explain the weight loss. All right? Involuntary weight loss, chronic diarrhea. And one thing also, guys, fat distribution changes. The body kind of changes. The fat is just in different spots. It's like a fat distribution change. The body changes. Okay? That's also something that you can expect. All right? This patient is going to have swollen lymph nodes. That's why when I take the students to clinical, they get upset with me because I want them to learn the lymph nodes. You may save someone. All right? Swollen lymph nodes. Weight loss, guys. And one thing I want you guys to write down and remember, weight loss, night sweats. Weight loss, night sweats, and fever. All right? This patient is very tired, guys. And not just like, oh, I'm tired, like malaise, like very tired, hard to get out of the bed. It's hard for them to get out of the bed. Pharyngeal edema and joint swelling, but not both joints, guys. Asymmetrical joints. So the right leg will probably be swollen, but not the left leg. Asymmetrical joint swelling and tenderness. Just from head to toe, the patient feels bad. The patient is swollen. The patient can't sleep. They're having night sweats. They're very tired. So it's affecting their work. Very malaise. Lymph nodes are swollen. Do you think this is around the time they may go into the hospital? This will may be the time that they start to get some help and become get tested. When they start not being able to get out of the bed, sweating at night, diarrhea. Okay, so expected findings. You can expect the patient to have ulcers of the mouth, guys. Rash, just like a generalized rash over the body. All of a sudden, just a generalized rash. Headaches. Remember the headaches behind the eyes, the headache and the pain. And one thing I want you guys to write down, I want you to write this down. Neurological signs and symptoms. Okay? Neurological signs and symptoms. Neurological signs and symptoms, guys. Okay? And it results from, it occurs because of HIV encephalopathy. So the patient may not be alert and oriented times 4, guys. The patient may be very young and you have to put the patient by the nurse's station because the patient keeps getting out of the bed. Okay. You have to constantly reorient the patient. Okay. It affects the neurological system. And Kaposi sarcoma, guys. Please Google that. I would have loved to put a picture here, but because of copyright, I cannot. So make sure you put Kaposi sarcoma. Please make sure that you Google that, write that down. That is an expected finding also. All right. Make sure you remember that. Very confused. Very, very confused. All right. Very confused. Topic 6, guys. Lab values. Lab values. You guys know you need to know your lab values. So go ahead and type in the chat what 2 lab values are very they're definitive diagnosis for HIV AIDS. What are the 2? There's 2 main ones that all you must know when it comes to HIV and AIDS. You can type it in the chat. Okay? Something that's very, very, yes, CD4 load, but it's something else too. How do we Western blot, okay? But it's something we give them first. The Western blot confirms it. It's something else. It's going to come up. So I want you to pay attention to this, okay? So, of course, we have the CD4 T cell count of less than 200 cells. All right. So make sure that's the number one. That's a big deal. This is when it progresses to AIDS. Okay. CD4 TD cell count of less than 200 cells and an opportunistic infection. Don't forget that. And an opportunistic infection. They'll say the lab results are reactive or non-reactive. I see a lot of the kids now, they love to put the HIV reports on the Facebook. Okay, they love to do it. Oh, it says non-reactive. That's what they say. Non-reactive. That's what they put on the Facebook. Non-reactive. Okay? Lab results are reported as reactive or non-reactive, and CD4 T cell count of less than 200 cells, guys, that means that it has progressed to AIDS. Now, when that patient comes in, guys, remember the ELISA, yes, Miss Megan, the ELISA and the Western blot. Okay, remember the first exam, when they have the flu-like symptoms, when they're not feeling well, when they're malaise, generalized rash, I don't understand what's going on with me. I'm very sick. I'm having the night sweats. Okay, I'm having the fevers. The first thing they're going to do is the ELISA. Make sure you remember that. ELISA, and they confirm with the Western blot. So always remember those. You need to know the CD4, of course. All right. But the ELISA and the Western blot also, guys, make sure you remember these two. All right. Of course, guys, for laboratory tests, they're going to do a pregnancy test, guys. They're going to definitely do a pregnancy test. They're going to do a liver function test, guys. They're going to do a BUN. They're going to do a creatinine. And that's partly because HIV/AIDS pretty much affects every system in the body. Okay. So just make sure that you guys remember that. All right. Remember, this patient is going to have a slew of tests run because they're trying to make sure that the patient is not exposed to, or the patient understands about opportunistic infections. So they're going to do influenza, varicella, hepatitis A, hepatitis B vaccines. They're going to make sure this patient is very, very safe, because remember, the patient doesn't have an immune system. All right. The patient becomes very immunocompromised. All right. So just remember those laboratory tests. All right. Very, very important. And we want to make sure that we keep our patients safe by doing the influenza, by protecting the patient from any type of opportunistic infections, any type. All right. So the medications. Now, this is where it gets a bit tricky, because these medications, it is a lot. So I remember Veers, but there are some Dynes here also. So just remember the medication. All right. This is one. If we're going to learn about HIV, if we're going to learn about any type of system disorder, guys, you have to remember the medications. They're going to hold you accountable for this, guys. So all of this, you're responsible for all the medication, the side effects of the meds, the adverse of the meds, the teachings, because remember, compliance is the biggest issue. Compliance is the biggest issue, because antivirals make you feel horrific. They make you feel bad. They say the treatment is worse than the disease. Sometimes it makes you feel really bad. So teaching is very important. Compliance is very important when it comes to HIV. Yes, and now they have to worry about COVID as well for opportunistic. You're absolutely right. Pretty much anything that it becomes an issue in the community, they have to worry about it. All right. So these are our medications. All right. So I'm just going to flip through them. The PowerPoint is in the I'll always put it in the description box, but I also put it in the chat. So, but just take a look at these medications, guys. And you will see this on the MAR. I had a patient and I was giving the patient the potassium and his potassium was very high. And the nurse, I called the pharmacist. I was like, hey, can I give this R potassium? And she says, yes, Katrina, you never hold someone's HIV medications. So you will see these medications on the MAR, guys. So just kind of take a look at them. All right. So there's antivirals therapy. And make sure you remember, let me just go back real quick. Make sure you remember the pre-exposure prophylaxis. So now you hear about that a lot. They call it PrEP. You hear about it a lot. Okay? You hear about it a lot. So there's a pre-exposure also. The antiretroviral therapies, nucleoside reverse transcriptase inhibitors, protease inhibitors, fusion inhibitors, entry inhibitors. And if you ever saw the life cycle of HIV, guys, what they're trying to do, they're trying to inhibit the cycle. Like they have to give them a cocktail to try to break the chain of the virus. I would have loved to put a picture here, guys, but they'll get me for copyright. All right, so this is also integrase inhibitors. Remember that word, inhibited. All right. So those are your medications. Make sure that you look at those medications. Okay. And you know what I will do? I will put the link for the chain so you can see exactly where those inhibitors are expected to work. All right. I will put that in the description box so you'll be able to kind of match the inhibitors with the cycle, where the part of the cycle that they expect to inhibit. Okay, because all of those medications, a virus is a cycle. So they're trying to stop the cycle at a certain point. So they give the patient all of these medications so the viral load will decrease. So I will put the chain in the description box so you guys can match the medications with the part of the cycle that they're trying to inhibit. That's a very good exercise for you. I'll put that in there for you so that way you guys can look at it. Okay, I won't withhold it, but they'll get me, Miss Amy. All right, so now nursing interventions, okay? Nursing interventions. All right, nursing interventions, huge deal. HIV. Guess what we do for HIV as nurses, guys? A lot of teaching. A lot of teaching. Okay, so I look at the nursing skill. You don't see NG tubes there. You don't see Foley cath. We do a lot of teaching and we protect the patient a lot. So let's talk about it. All right. For nursing interventions, we do a lot of coping techniques. We teach our patients how to cope. We have to teach them how to cope with their altered or the changing body image. Remember, the fat distribution changes. We have to provide them with emotional support, because can you imagine how you would feel? You are a 31-year-old young man, and now someone, you have HIV. So a lot of emotional support. Okay. And we have to model positive coping strategies. So one thing that we want is for our patients, for our clients who have HIV, to join support groups. All right. Join support groups so they can be around positive coping strategies, people that have positive coping strategies. All right. End of life care decisions, guys. This is how we advocate for our patients. Our patients have rights. Our clients have rights. This is how we advocate for our patients. All right. And one thing I want you guys to really, really be aware of is inspect the mucous membrane for irritation and ulceration, guys. Remember, we don't want our patients having any type of opportunistic infection. So we're teaching them about mouth care. We're teaching them about avoid glycerin swabs. We want them to avoid it, and they have to use normal saline because we don't want the patient mouth to get irritated. Okay. So mouthwash daily. That's a big thing. Mouth care. Mouth care, mouth care, mouth care. Avoid the glycerin swabs. Okay, it's going to irritate it more. All right. We have to teach our patient about fluid intake. Fluid intake during episodes of diarrhea. Okay. Encourage the patient to avoid, guess what? No caffeine, no alcohol, no dairy. Okay. No foods high in fat. You need protein. No foods high in fat. No dairy. No alcohol. No caffeine. Okay. No fresh juices because it's acidic. Okay. No caffeine. No alcohol. No dairy. No foods high in fat. Because we tend to want to give everybody something fattening when the patient starts to lose weight. No foods high in fat. No fresh juices. No acidic juices. Okay. And also, guys, fluids at room temperature. Room temperature for this patient. All right. And we want our patients to avoid gassy foods, guys. All right. So those green leafy vegetables can cause gas. So gassy foods, guys. Avoid it. Diet. Drinking fluids at room temperature. Okay. No caffeine, no alcohol, no dairy, no foods high in fat, no fresh juices, no acidic juices. And this patient has to do meal planning because can you imagine? Okay, can you imagine the lifestyle change for a 32-year-old? No fatty foods, so no restaurants, no acidic juices, no caffeine. So meal planning, all right, to ensure adequate nutrition, guys. All right. And I want you guys to write down a dietitian. Tell the physician if it's not on the order, tell the physician, do you want to consult a dietitian? Because we know that wasting syndrome is definitely an issue. All right. So dietitian, guys, and meal planning, because it's going to be a hard coping. It's hard to cope with this sort of lifestyle change at that age. Okay. And guys, believe it or not, another nursing intervention is pain assessment, guys. Pain assessment, pain reassessment. Pain assessment and pain reassessment. All right. So this patient seems to may be on opioids. So make sure that fiber, drinking fluids, pain management. Pain is an issue. All right. Make sure if you're going to do a pain assessment, you give a patient a pain medication. Make sure you're doing a pain reassessment. All right, guys. Perianal care. Okay. Perianal care is a big deal, guys. Lotions. Recommend lotions for the patient. IV fluid replacement therapy. And you always want to inspect the skin, guys, and the mucous membrane, because remember, this patient is susceptible to opportunistic infections. So make sure that you are aware of that. All right. Meticulous skin care, guys, for this patient. Meticulous. This is where you may see that sitz bath. This is when you may do your recommend your first sitz bath or facilitate your first sitz bath. Okay. Lotions do help with the irritation. So you want to make sure if you're doing perianal care, sitz baths, lotions help. All right. Always assess your patient. Your patient may need some IV fluid replacement therapy, especially if they have diarrhea for a very long time. If the diarrhea is prolonged, then you may have to initiate IV fluid replacement therapy. Call the doctor to get an order. And you always want to inspect the skin. You always want to inspect the mucous membrane. And you want to do meticulous skincare because you don't want any type of compromise of the skin because of this patient is susceptible to any type of infection. And the patient doesn't have an immune system. So be very careful with that. And you always want to tell the patient, guys, to maintain physical activity. Now, it's a very good coping strategy. Okay, it's a positive coping strategy. Maintain as much physical activity as tolerated. All right, just make sure the patient is resting in between. Okay, and if the patient is in the bed, if the patient is bed bound, make sure that you are turning and repositioning the patient as much as possible. Okay, as much as required. Every 2 hours is required, but you can do it more than that. Okay, depending on what stage the patient is in, you may have to implement isolation precautions like contact precautions. If the patient is on contact precaution, guys, the patient does need their own dedicated equipment. Okay, so make sure that you're reading the order in its entirety so you'll know exactly what type of precaution the patient is on, isolation precaution the patient is on. All right, and I think our last section, guys, we're almost there for HIV. We're almost there. Skills. And guess what the skills is going to be? Our nursing skill. Teaching. Cleanliness, infection control, guys, nutrition. So let's see. Our nursing skill for HIV is nutrition, advanced directives, contact precautions, coping. Okay? Nursing skill. Let's go. Let's do it. So nursing skills. Make sure that you're advocating for your patient, guys, in regards to end of life care. Family therapy, guys. Remember, coping strategies, group therapies. If the patient has impaired swallowing, guys, remember nutrition is our thing. But if the patient has impaired swallowing, you have to put the patient on aspiration precaution. All right, and you always want to measure intake and output to ensure that there isn't any type of acute kidney injury. Nutrition. And meticulous oral care, guys. Meticulous oral care. All right. We have to just keep in mind that long-term care may be provided, may be necessary. So we always advocate for our patients, okay? If the patient requires long-term care. Nursing skills, guys. Teaching about medication compliance. Medication compliance. The patient is not going to get better if they are not taking the medications. Pain. If you're going to give the patient any type of pain medication, make sure that you are doing pain reassessments. And if the patient is on any type of contact precaution, make sure that you are wearing the proper PPE. So you have to know how to don and doff properly. All right. It keeps the patient safe and it keeps you safe as well. All right. We teach our patient about relaxation, stress techniques. And remember, guys, this may be the first time you guys have to assist with a cyst bath, explain a cyst bath, teach about the cyst baths. Because remember, we have to provide perianal care. All right, so let's run through the teachings one more time, guys. Teaching. It's a lot of teaching for our client. A lot of teaching. All right, so let's see if you guys remember. Just a review real quick. Medication regimens, because it's important. All right, the patient is not going to get better without medication regimen. Medication compliance, okay? Medication compliance. And you have to teach the patient about safe sex as well, guys. All right? Safe sex practices. All right? Make sure the patient is aware of impending infections, because remember, the patient is susceptible to opportunistic infections. Nutrition, vaccines, guys. Follow-up laboratory testing. And the one thing that I did discover was they want the patient to Omega-3 fatty acids, guys. Omega-3 fatty acids. And we talked about those foods that may irritate, like caffeine, alcohol, dairy, foods high in fat. Stay away from acidic juices. Okay. So I didn't take up too much of your time. And just to reinforce the lecture, guys, make sure that you go into your Saunders. Yes, Tamiko, abstinence. But they want us to really preach more now safer sex practices. Now, to make sure that you really understand the material, guys, if you have the Saunders book, which I highly recommend, I love the Saunders, reinforce the lecture with Saunders Nclex Comprehensive Review. So what you want to do is you want to click study, click content area, and then click immune. And then there are 103 questions. There are quite a few HIV questions. So it's a very good guide. I really love Saunders. And these are just the credits, the images, so I don't get hit with a copyright. And the PowerPoints, guys, are in the link, but I'll also put them in the description box. And that's it, guys. Thank you for joining me Friday night. We are such party animals. Here we are on a Friday. All right. Who would have thought? All right, guys. Thank you so much. And I'll be here Monday night at 9:30. We're gonna do rheumatoid arthritis. Love you too. Thank you, Megan. All right. So Monday night, meet me here. You're welcome, guys. Good night. Study hard and email me if anything. All right, guys. Good night. Bye, guys. Good night.